How you doing? Today I'm going to talk some more about, the last time I gave a talk, it was about things I have to offer people. And I got a lot of responses from that, and so I decided, a lot of people were calling me up, a lot of people were asking me questions, a lot of people were emailing me stuff, and so I thought to myself, maybe I'll just make another tape and explain to you, answer the question. Like I said, a lot of people were asking me these questions, so I thought maybe I'd answer the questions like, how come I'm supposed to know I need a doctor? Because a lot of people don't know how come they know they need to see a doctor. And so that's what I'm going to explain to you today, because it's important to have a doctor that you can go to and ask questions, get some help if you're in pain, or just to help you, because that's what we do. We teach people how to take care of themselves. I mean, you got to sometimes come to the office, but a lot of times, you can do things to take care of yourself at home. And when that's not working, then you come see the doctor and you get some help. And then the question is, how come you got to go see the doctor? So that's what I'm going to talk about today. How come you got to go see the doctor? And when I say doctor, I mean I'm talking about the chiropractor, because I'm a chiropractor, and I don't practice medicine. I practice chiropractic, and the way I practice chiropractic, it's natural medicine. That's what it is. It's natural. So we don't use any drugs. We don't do surgery. We don't give any injections. We don't do that stuff, because what we're trying to do is help your body take care of itself. And basically, from the chiropractic standpoint, we're talking this. When your spine is out of line, which means when you got a bone in your back or your neck that's out of place, putting pressure on the nerves, you got a pinched nerve. And when you got a pinched nerve, you got a problem. You may feel it, or you may not feel it. But that's basically what the chiropractor does. And then they'll give you, at least for me, because in my office, what I'll do is I'll show you some what we call whole food nutrition concentrates that have all the vitamins and the minerals, because I don't use any vitamins. I don't use any synthetics. I just use whole food concentrates that are raw, organic, natural, non-GMO, to help strengthen the ligaments so the bones don't sit on the nerve anymore after I adjust it. Then I show you some exercises at home, some traction maneuvers at home, things that you can do at home. So I'm going to explain to you how come you got to go see the doctor. There's four basic reasons. And so I'm going to go through them for you right now. Number one, you got to go see the doctors when you got pain. Because when you got pain, you got a problem. And when you got a problem, you got to do something about it. So what do? You go to the doctor. Now, let's say you got a pain in the neck, like over here. You got a problem. The pain is telling you, you got to do something about that. The chances are, most of the time, you got a pinched nerve, and that's putting pressure on, the bone is putting the pressure on the nerve back here, and the muscle's going like that. So you get the bone off the nerve, the muscle can relax, because the nerve has its power supply. Okay, so that's number one. You got pain. You got to go see the doctor. You may have a pain in the back, in the neck. I mean, I even have patients that have pain in the stomach or in the leg. It just depends. If the bone is out of place in the back or in the neck, you got a problem that a chiropractor might help. And there's a lot of research on this. I mean, it was something called the Windsor study that was done back in 1929 at the University of Pennsylvania. These doctors, they did these studies on these autopsy patients. They did autopsies. We call them autopsies when somebody's dead. They studied their backs and necks, and they found all the time when somebody had a bad organ problem, they had a bone out of place in the neck or in the back somewhere. So the point is, when the bone's out of place, it's going to affect the body and the neck and the nerves, and it can affect the organs. So you got to pay attention to that when you got pain. Excuse me. So that's number one. You got a pain, you got a problem, you got to go see the doctor. If the doctor can help you, he's going to tell you. If he can't help you, he's going to tell you. Well, that's what I do, and I'll send you to wherever you need to go to get help for your pain. Number two is this. Let's say you sit at a desk. I mean, a lot of people sit at the desk all day long, right? And they get up once in a while and they take a walk, or they just get up and walk around or something like that, but then they come back to the desk. And what happens when you're sitting at the desk all day long, you're not using any muscles. You're just like at a computer. I mean, that's what I'm talking about. You're like a sack of potatoes. You're just sitting there like this. Or you might be on the phone, so you're like this. Your head's like this. Or you might be up like this. But you're not using any muscles. You're just sitting there like a sack of potatoes. And what happens is that allows, gravity is pushing down on your spine. It's stretching the ligaments. The bones can't hold their position. They put pressure on the nerve, and you got a problem. You might not feel it. So I'm going to tell you how you can check yourself to see if you got a problem, another kind of problem, and you need to go see the chiropractor. Watch this. Okay, so let's say you're sitting at your desk like this, okay? I'm going to show you something. You can do what we call a range of motion test. That's where you check the range of motion of, let's say, your neck, because that's what we're going to do now. We're going to check your neck. You go like this. You turn your head to the left, like this. And you go, oh, that's pretty good. Yeah, that's pretty good. Okay, so you turn your head to the left. That's your right, my left. Okay, so then what you do is you turn your head to the right, and you go like this. And you go, whoa, I can't turn my head this far to the right. Now, I'm not talking about real far to the right, and your left, but not as far to my right or your left as when you turn it this way to my left or your right. I mean, your head's not supposed to be your neck's not supposed to be like a chicken, but, where you can turn it all around, look out the back of your eyes and out back that way. But you should have a certain range of motion. So if you go this way and it's good, that's good. If you go this way and it's not so good, you got a problem, because you could have bone pushing on the nerve and the muscles in spasm and you don't even know it. And a lot of times you don't know it until you go get checked. And how does the chiropractor check that a lot of times? First thing they'll do is they'll check the range of motion, but they'll also feel the back of the neck here. And we can tell if the bone's pushing on the nerve. So that's the second reason you should go see the chiropractor. When your range of motion in the neck or in the back is not what it should be, because let's say you're sitting at a desk all day long and you're kinked like this. I mean, sometimes you even just get a headache from in the wrong position. It could be from that too. You could be getting a headache because your range of motion is not that good this way. So that's number two, if your range of motion is not what it should be. Okay, also in that number two, it's a little footnote. If you're standing up straight and you notice your head standing like this all the time, that's not right. It should be standing up straight. Your nose should be straight up and down here, right to your chest bone and right down between your feet. Because if you're like this, that means you got some muscles pulling you this way because the bone's out of place, putting pressure on the nerve. So we call that a postural evaluation. Remember that, a postural evaluation. So your head should be like this. You can also look at your head, but you can also look at your ears, because your ears may like this. You might be like this. And so if your ears are like not level, that's not good. Or your shoulders might not be level like this. If you stand up straight and you see yourself, say, okay, that's a problem. And then you check your pelvis, because that could be off too. So in other words, posture and range of motion, if they're not what they should be, and you know what I'm talking about, you need to go see the doctor. The chiropractor can tell you if you got bones pressing on the nerves. Okay, that's number two. Now number three. Number three reason you know how come you need to go see the doctor is this. If you get let's say, an accident like that, or you hurt yourself at work with picking up something too heavy, that's a problem. So let's go over the first one first. Let's say you're just sitting there, you're driving your car, and you come to the stoplight, and you're sitting there waiting for the light to turn, and then boom, you get hit from behind. What happens in that split second is that the ligament, your head, we call that a whiplash. That's where your head goes like this. And it might go forward and backward a couple times. You might hit the back of your head. Usually you got a seatbelt on, and so it locks you in, and you go whack. You flip your head forward. If it doesn't lock up, it hits you. You hit your head on the steering wheel. That's a problem. You could smack your head, knock yourself out, things like that. But we call that a whiplash, because you get whipped really hard. And usually what happens is, maybe not right away, but within a few days, maybe a week or two, you got this pain in the neck, you got a pain in the back, you might have a pain in the arm, you might have a headache. So when you get in a car accident, that's an injury. like football players, they're getting in they're getting hitting each other all the time. That's like a big injury like that. You should go get checked by the chiropractor to see if the bones are out of place, putting pressure on the nerves. And again, we check that with feeling the nerve, checking your posture, checking your range of motion, and also an x-ray. That will help too. Now, let's say you're at work and you're doing heavy work, like blue-collar work, like lifting or plumbing or construction or building a house or something like that. So what happens there is you pick something up and it hurts. You feel your back hurts, and then you got to keep going. So what you got to do is this. You do one of two things. You either go see the doctor, or some guys, tough guys, you say, hey, you're a tough guy. I'll work it out. I'll work it out on my own. And they wait. And then a week, 2-3 weeks later, hurts even more. So you can't be doing that. You got to go see the doctor if you bend over and pick something up and it hurts. Don't be a tough guy. Take care of yourself. Go see the chiropractor. Okay. And number 4. So that's number 3. Now we're going to go to number 4. Number 4 is this, okay? Number 4 is when you don't have any pain. You think everything's just fine. But it's like your car. You take it in to get it tuned up. You want to see if everything's okay. You can go to the chiropractor and say, hey, my friend comes to you all the time and he says you help him a lot, but I don't know if I need you. Can you tell me if you need me, if I need you or not? And I'm going to say, yeah. I'm going to take your history. I'm going to find out if you've ever had any accidents or injuries, broken bones, things like that. What kind of work do you do? And then what we do is we just help you decide, help you figure out if you need chiropractic treatment. That's what we do. So, and we do that again, but we feel the back and neck. We check your posture. We check your range of motion. I'm sorry for the interruption. It's my phone. I didn't turn it off. But that's number 4. You can go to get checked out. And like I said initially, people are walking around with lots of problems, heart, overweight, diabetes, cancer, and they can go get checked out, and you can find out a lot just by getting your back and neck checked. And when you get that checked to see if there's any bones out of place, putting pressure on the nerves, you can tell a lot. So if you ever feel like you need to get checked out by the doctor, these are the 4 reasons how come you got to go see the chiropractor. And I'll be happy to take care of you. If I can help you, I will. And if I can't, I'll tell you. Because I'm not going to waste your time and my time. That's what I'm going to do. So you let me know sometime. You'd be happy to give me a call. You can go to my website, www.oregonwellnesscare.com. You can call my office, 503-472-6550 in McMinnville, or Portland, 503-977-0055. You give me a call. I'd like to meet you and take care of you. And thanks a lot, and you have a good day. I'll talk to you next time. Bye.